this kind of outbreak that we never had before in the history of our country, this type. It's important to communicate and make sure we are all together against the virus, against the outbreak. So to begin, this virus in its kind is something that most of the time in the history starts from the hospital, the healthcare facilities. Because when you are sick, when you have it, you can't keep it at home. You go to seek care. And in a few places where it has happened in rural, in the community, that explains also access to healthcare. Unfortunately, it leads also to exposure to the healthcare workers, especially those who are dealing with very sick patients. That is what happened to us, to our context. We're always ready to have this kind of situations. And we've been using the previous outbreaks, which were unfortunate but happened. And this is not the last one, because we are always having these alerts every time. But Marburg has this particularity of being aggressive once it gets into the body. I think on social media, some people asked which organs they affect. We'll talk about that. But in the almost 7 days, we detected the first day the virus, we activated the response, and we are seeing that it has so far affected those areas I talked about, which is expected when you detect. But you have to work very quickly to contain it before it gets far beyond where the first case or the contacts of the first case were detected. So I think the numbers are changing every day. Even today we will be announcing the new results of what we've tested. But let me use the latest numbers that maybe to begin, that we have 29 cases confirmed, and unfortunately we lost 10 lives. But there are also some good news that some patients are improving and recovering. Soon we'll be doing 2 tests that are required to say that some people have completely recovered, but we are seeing some positive trend that it's not about getting it and dying. There's also some good results that are coming. But the high mortality rate explains why we are talking about it today, and why it's different from Mpox, and why it's also different from COVID in a sense. We'll talk about that, but let me pause there.
Right, pause there for now, and then let me bring Dr. Brian. In such a situation, when a country gets on high alert, and an announcement is made that, hey, citizens of this great nation, we have an attack in the form of a virus or a pandemic that has come in. What usually happens from where you sit, from WHO perspective, in terms of support systems? And in the case of Rwanda right now, what role are you playing other than the support with the kids that we've been seeing and all that?
Okay, so maybe I would start off by just highlighting, and first of all, thank you so much for this opportunity to be able to engage and provide some information to the listeners. I think let me start off with just highlighting, as Minister has said, Marburg is a very serious infection, and one case of Marburg is an epidemic in a country. That's how serious it is compared to other diseases where we wait for a certain level of cases being reported. So usually what then happens is once a country identifies a disease, so it's not just about Marburg viral disease, but it can also be any other infection, the country, based on the international health regulations, would report to the World Health Organization, because it's important for WHO to become aware, and WHO to also inform other countries so that they can also be aware. So that was done very early, very quickly. The government of Rwanda reported to WHO, to the international health regulation authorities. They proceeded to inform other countries, because we have what we call IHR national focal points. So that somebody in each country who is responsible, so that's usually somebody from the ministry. So we have somebody from the ministry who is responsible.
Yeah.
And then we have informed all the focal points globally, because it's important for all countries to become aware, to begin to also put in place measures to prepare themselves. And then, of course, we then start working with the country in terms of preparing. There are lots of preparations that need to be in place.
Yeah.
We work with the country even before even getting there. Usually it's good practice for any country, once you identify a new infection, or even an old infection, it's important to have that verified also by an external laboratory, which is not that same lab that did. So Rwanda has the capacity to test, and they were able to do this, but we then working with them to make sure that it's also verified from outside. And then we start the whole process of now engaging with government, with partners, putting everybody together, ensuring that there are teams, and then maybe we will go to some of the details. So really now prepare to support the country to begin to move forward, and I think later we'll talk about some of the specificities in terms of some of the support. That
one of the specific things that WHO has done is to categorize or rate the Marburg virus at risk group 4. What does that mean, especially for people who are probably taking it lightly and saying, nibya bindi batanje kutukanga bashaka kutushira kuri lockdown, they want to lock us up, or someone is just playing with our mindsets. Let's try to explain this. It's very important. Maybe Honorable Minister and then Dr. Brian.
Yeah, I can start.
Yes.
To give you an example, we are now dealing with 2 outbreaks. We have Mpox, which was reported a few weeks ago, and we have Marburg, which is now 6 days since we first tested it. Mpox is classified between level 1 and level 2, which is the lowest is 1, the second is 2, and the highest is 4, as you said, very high. So one is very low, is low, another one is very high. And that explains exactly what we have to do for each one to respond. And you may ask what determines what explains the classifications being 1 or 4. There are several indicators, but WHO is the one defining it. But let me explain, because these are things we are always dealing with every day. Number 1 is how the virus or the pathogen transmits, and how fast it can move from an animal to human, human to human, or environment to humans in general. Number 2 is how it can damage someone's body or organs once it gets inside. Number 3 is the options of prevention in terms of vaccines or treatment, therapeutics, and also the outcome since you get that. So Marburg is complicated because on those boxes you probably tick only 1, and all the others are just not. I would say transmissibility can be not as much as COVID because it's not an airborne, but once you get it inside the body, it multiplies so quickly that it gains the territory of your body within 2 days. Then you start to develop symptoms, as it also grows very fast to attack your defense system, which is very specific for Marburg, that it destroys your defense before your defense even wakes up. So which is how some organs will fail if you don't have supportive treatment early enough. So that explains the complications in terms of making you sick, even high mortality related to Marburg. Then no vaccines proven on Marburg. There are some vaccine advanced in trials. We're getting some vaccines hopefully soon. We are working with WHO to activate these mechanisms. And all therapeutics are under trial. What you have to do is to apply the supportive treatment, symptoms treatment, and some medications that are now in research that are helping. So we have some of these options already in country.
Yeah.
And that explains why it's the highest level of severity among all other viruses, other outbreaks.
Yeah, yeah. And listening to this, Dr. Brian, I want to understand from a lessons learned perspective. This is not the first time East Africa is hearing about Marburg virus. I'm aware that in Tanzania, they had cases. I think it's 2023. Last year. And you know, what I'm worried about, or what I'm wondering is what lessons were learned from the Tanzania situation in terms of seeking medical trials to try and see how best to fix this so that there's a never again context of such a situation in dealing with such viruses.
Yes, so many lessons have been learned. By the way, it's not just Tanzania. It's we actually have had cases, outbreaks in the DRC, although a bit earlier.
Yeah.
But in 2023, we also had Equatorial Guinea, where they had a bigger outbreak there than what we saw in Tanzania. So many lessons have been learned. But when we talk about getting vaccines and treatments and therapeutics, one challenge with the outbreaks we have seen with Marburg viral disease is that though it's a severe disease and we do see cases, but the numbers have not been as high, for example, as we have seen with COVID, as we have seen even with Mpox. You need enough numbers, and you need an outbreak that happens over a reasonably long time for you to be able to start. Because for you to do these studies, you have to prepare for them. You have to get the therapeutics and the drugs. And usually for a case like Marburg, which doesn't have those, and they haven't been produced, it takes longer. So all the outbreaks we have had, we have not really had enough time to be able to test the different therapeutics, the different vaccines.
What's missing? What's missing, Dr. Brian?
Well, it's a whole, there are a number of issues. Of course, there's the issue of funding, because it's not, even though it's very lethal, as Minister was explaining, the fatality rate goes as high as 90%, so that's extremely high. Although in some settings, we have seen fatality rates of 24%, so it's a whole range that we have. So it is quite fatal, but because of the lower numbers, we have that challenge that we have to prepare and have all these vaccines and therapeutics fast enough, and then the outbreak needs to happen for long enough for you to do the trials. Because the trial,
I was wondering, when you said the pandemic has to happen for long enough, they want to understand, what do you mean? Do you want to see more fatalities for you to get to a point of doing the studies? Or?
Not that we want to see it, but the logistics of getting the drugs and the therapeutics from the manufacturers, it takes longer. You remember, it takes quite some time to produce many of these drugs and vaccines and therapeutics. So it's sort of like a mix, where that's like one of the advantages, that in many of the outbreaks they have been short-lived. They've not had many people, so that's been positive. But unfortunately, then that gives us challenges in terms of enough time. Of course, we have funding issues, because you need to have a lot of resources very quickly to get these drugs and therapeutics ready on time. And of course, many of the outbreaks have happened in our region. Yes, the first outbreak did not happen in our region. It actually happened in Germany, and that's why you have the name Marburg from it. But many of the subsequent outbreaks have happened in Africa, and there are systems issues, in addition to resources, in addition to the time that we need to be able to develop therapeutics. So it's been a bit of a challenge.
You said this is a conversation. Let me complement that. It's classified as a rare disease.
Yes.
Being rare means it's not something you see all the time. And when it comes, it appears and then it goes out. But when it is happening, it destroys a lot of things, including people's lives. And that, to me, there's an opportunity missed by the researchers and scientists, that it appears shortly and then it goes away, and then you focus on other things. And this research, he is explaining, sometimes they need bigger sample size to confirm whether treatment or a vaccine is working or not. So you could see it in two ways. Even the design of research and trials has a lot of processes and bureaucracies that should be improved. We should use technology we have, for example, to activate quickly research and pick the virus, sequence it, and try vaccine and treatment. But traditionally, research takes time. For example, for COVID, a vaccine, normally before COVID, a vaccine could take 10 years in the process to be developed. But during COVID, the push of COVID being a global pandemic has resulted into the 10 years being 9 months. This was historical. It's a change that never seen before. So with this repetitive outbreaks, we hope that this transformation in science is going to happen, and that Marburg is going to be finally get a treatment and a vaccine.
Right. And maybe let me come in, because you talked about the lessons learned. So we have also learned lessons in terms of how to do this quickly. So about 2 years ago, WHO started a process of preparing, because after COVID it became very clear that, as a minister has said, it was taking a long time to develop therapeutics and vaccines. So WHO put together an R&D strategy. We brought together manufacturing companies, we brought together partners, countries, donors. So we started a process that ensures we are ready for, in the event of this happening, with these even these epidemics that are very short-lived. So we already had a whole process. So in January, for example, we had already, as WHO, identified, I think we have 17 countries that we identified that were ready, that were willing to try these, do these clinical trials very quickly. We trained them. We identified scientists. So Rwanda already had a team, already identified. So as soon as Rwanda identified this epidemic, we've already been working with Rwanda to get their scientists ready. We've talked to manufacturers, where, as Minister has said, there are some drugs and some vaccines that are not approved yet, but they are of promise. So in the next few days, actually, we will be bringing in some of those therapeutics and vaccines, working with not only the government, but also the manufacturers, or also other countries, also other donors. So we've learned our lessons, and for Marburg, we are actually looking forward to be able to come up with some therapeutics, some vaccines that we can actually use. And we expect that the process, I think we've learned a lot, we'll be able to do it faster in future.
We'll be watching, we'll be monitoring that in terms of that fast, because there are people who feel like we are not learning. We are always reactive and not proactive. Honorable Minister, especially on that note of being proactive and reactive, you know, families right now, and a lot of us are worried. Some don't know how to deal with this. They're hearing it probably for the first time. I was in a cab just yesterday. The driver was being called that their mother, who stays outside of the city, is unwell. And, you know, they've just admitted her because they are suspecting. And this guy was saying this is just things for private hospitals. They just want to make money out of my mom. You know, it is normal for people to get cold and all that. What do you want to tell the country tonight, especially those who are worried, they don't know what to do? Should they pull their children from school? Should they stop going to the supermarkets? People who are just scared because of lack of information, of awareness how to deal with this virus.
So the first thing is to tell people that every time there's an outbreak or an announcement like this, the first thing that comes out quickly is panic and fear. And sometimes it's important to manage that, because it's more dangerous than the problem itself if you are not calm enough to say, hey, what are we dealing with? How can we manage it? What tools do we have? And how do we communicate the best science we have? And that is something we've been doing since day one, that we communicate what we've seen in the lab, what it means, what are we going to do. And sometimes it's important to keep communicating and sharing. After the very first days, people will understand and they will know exactly what we are facing. But understand also the COVID memories and it's still fresh.
Yeah.
That's why you mentioned, for example, people run to pick masks. And others just staying at home, not going out. That is a problem itself. And we should not be encouraging people to panic and get that fear, because our job is to detect, do the contact tracing, tell people what we are finding, and then if it's massive enough and we have to activate other measures, we will see it, we will know it. But at this time, with the nature of the virus and how it is transmitted, we cannot advise or recommend that not to go to school or close markets, because that is more, actually, it impacts lives of people than the virus itself. So I would say that what we recommend right now is there are 3 things that if you see, just think about what we are fighting and tell us. High fever, headache that are severe, and also muscle pain that is unusual. The 3 things you think this is malaria. It's very typical to malaria. That's why you can have malaria and Marburg at the same time, or we can have Marburg and not malaria, or malaria alone. So that is determined by a test. And that's why we are telling everyone, if you have high fever, you have severe headache and muscle pain, sometimes gastrointestinal problems, just tell us, because missing that opportunity for next day, Marburg is very fast. It's going to be complicated. That's the first thing. Second, it's a disease that comes to you from a contact. You can't pass by or sitting next to you and get it if I haven't touched you or the surface where you touched.
Yes.
So hand washing is very important. Sanitizing is very important. And we've done this before. It's not something you're telling people. So we go back to that practice. Yeah. It helps for Marburg and for other diseases.
Yeah. But Minister, before I come back to Dr. Brian, how do you convince someone who feels, especially on the aspect of communication that you mentioned that is very key, who feels that this thing landed on my WhatsApp, first of all as a rumor or as a leaked message? And I'll say this because I also saw it. It started off, this is a message, internal communication. Some people are saying it's from RBC. There's a strange thing happening. There's a disease. People are dropping somewhere. To now having a confirmation that, hey, Rwanda, we have this situation. And that coming after people starting to ask, hey, are these things going around on WhatsApp true? Or these are just mere rumors as usual on WhatsApp? And then now the ministry comes out. Just try to explain to us, take us back on the timeline.
Yes.
Why did the ministry take long to announce? In the eyes of those who felt we already had this information through some quarters, although we couldn't confirm. And then now later the ministry comes out to explain.
I'm glad you asked that, because things happen so fast, and sometimes social media is very important, and sometimes we learn also from rumors to go and detect what is happening. But for this case, because it's a disease that takes people's lives, sometimes you may see that communication started by saying, why this person passed and what are we doing about it? Could happen in a matter of minutes, while even our lab was still processing and questions are being asked. But I would say this virus was confirmed, and within 24 hours, everything, confirmation, information to WHO by IHR, and within those 24 hours, the official communication has already been issued. But with the speed of social media, I think we are also learning how to run that pace, so that any delay in between becomes like information has been hidden. But I can tell you that it took 24 hours from the time the virus was detected, the time was announced, and all the processes. This is a PCR testing, which you have to start by inactivating the virus. It takes hours. It's not like COVID, you just prepare and run into PCR. It's a technique of testing. Because it's so dangerous, you inactivate, you start the process. It takes hours, maybe up to 6 to 8 hours. And if you see something unusual, you have to repeat it. So with the clinical presentations of the patients, with the lab conducting the testing and confirming the testing, that took about maybe 20 hours. And within that period, for reasons that we know about social media, especially once people lives are associated, we've seen those rumors you saw yourself, but we followed every single step per our playbook, per the international health regulations. But by the time it was published, I think there were a lot because of the fear and panic. And what we did is to make sure we communicate as transparent as possible, and that's why we're here.
Yeah, but I know we'll bring in Dr. Brian also. Explain to that person who probably feels maybe that is how we had 300, like you said, who had contact in terms of the contact tracing for the 300, and also the aspect of not already knowing right now the source or the origin. I just want us to convince this person who probably feels, have lost hope. The surveillance system has to be stronger than myself because the government has resources, there are people to be able to pick this before it gets to me. How do you explain to this person who's losing faith, who's feeling disappointed or let down?
I think we have a very strong surveillance and response mechanism. First of all, there's no person in the world or any country stronger of reach whatsoever that will tell you that an outbreak will not happen in that specific area. That will be a lie. And the only thing we can tell is that once we detect, we respond quickly and stop it before it becomes a pandemic.
Yeah.
Starting with an outbreak, these are cases.
Yeah.
Then pandemic, it has affected countries or beyond, or community transmission, steps like that. And that is what we've been practicing even with other outbreaks. Yeah. So when you talk about contacts, you could talk about 300 or 500. It depends on, within a day, yourself, only one person can make 50 contacts.
Correct.
The time you leave this studio going back home, you will probably meet a number. So if you are 10, you can easily make 200 or more.
Yes.
So 300 is not a huge number per se. And you're talking about, if it's a healthcare provider, the people working around, the family contacts. And that is, I would say, it's not big, it's not small, but it's a good start, and we have the capacity to exhaust all those contacts within hours. And what we are doing is now to test them, retest them, and whenever we see another positive, we trace again.
Yeah.
So resources are there.
But you found them, the 300?
Yes, we reached out to even beyond. So we were trying to even go beyond. If, for example, I've been here and I test positive, you will be my contact.
Yes.
And also the people behind the camera are going to be my contact, but second generation contacts. So including them is better than excluding, because you never know.
Right.
Maybe I touch them, maybe they touch the handle on the door. And that makes the bigger the contacts, actually the better the system is, because you're giving yourself enough chances to pick the virus.
Right. Dr. Brian, I want to bring you in on this conversation, especially on the aspect of our forefront fighters, the doctors. We talked earlier on about lessons learned. And in every pandemic, they mostly are the first or the most affected. These are people we need to go to support us when we are sick. They have the technique, the expertise. But when we hear that they're the most affected in terms of the deaths we're hearing, in terms of the infections, what does that say in terms of, from a global health practice in terms of protecting them, safety. This is not the first time this is happening. What's happening here?
Well, let me, I think, I totally agree with you, and for WHO, we prioritize the health and the safety of health workers, and we work with our partners, with governments, to ensure that the systems protect them. But we have to understand, as Minister was saying, the challenge that we have with this type of disease. First of all, I think Minister already talked about the way it's transmitted.
Yeah.
It's not as simple as coughing and breathing, and then the next person is infected. Usually it needs very close contact. That's one. Two, because usually someone begins to transmit when they have symptoms, when they are sick.
That's true.
So it's only when they've come out of the community and gone to a facility that they then are more likely to pass their infection. Okay? So we have to understand the context of a disease like Marburg viral disease, where it tends to affect health workers more. Actually, in many of the outbreaks, they've only been identified when we begin to see health workers getting sick, health workers dying, and then we try to understand what's going on.
Yeah.
We do the testing, and then we discover that the disease is happening there. So it's part of the challenge of this type of disease.
Yeah.
However, of course, it means that we have to improve our level of suspicion. But remember, this is happening in a country that has never had this type of infection. In countries, for example, where they have had those type of infections, they're a bit quicker at noticing that because they have some history and some experience.
But let's pause there for a minute. We're a global village now. That's very easy for us to learn quickly, through, like the Honorable Minister said, technology, internet has connected us. Tonight, there are mothers who are not coming back home. Fathers who have gone because they were serving to save lives, but they're not coming back to their children, back to their families. And they're feeling let down. That once such pandemics happen is when photo ops are going to be happening. We've brought PPEs, we brought this and that. And they're feeling, no, we can do better. What can be done better, Dr. Brian, so that we are not having this as a conversation when pandemics happen or when there are outbreaks like this?
Of course, we need to do more in terms of preparedness. The different areas of preparedness. Minister talked about our surveillance to improve that. Yes, Rwanda is one of the best surveillance systems, but this can still happen. Actually, sometimes the reason why a country like Rwanda can pick it up this much earlier is because it has a strong surveillance system. However, of course, that's not enough because, for example, as you have said, if we are going to lose our health workers who are really the bedrock of the health system, they're the front line, that's a big issue for us. So we need to do more to strengthen our systems so that's all areas, including our communities. We talked a lot about communities, because remember, we did talk about that when it gets to the health facility, it has come from the community.
Yes.
So some of our surveillance system, particularly the community side of it, we definitely need to do more. You remember we have been talking about the pandemic fund that we talked about recently. We have been talking about the pandemic treaty that WHO is talking about, because it's clear that yes, we have done a lot, but there are still a lot of gaps. The resourcing that we need have been quite limited, and that's why we're very happy, for example, for Rwanda has been able to, with our support and other partners, we have been able to mobilize some resources coming. So we need to address some of those areas: surveillance, lab, ensuring health workers are more protected than, especially for these diseases that are much more unusual that we didn't expect. So we do have a lot of work to do to strengthen our systems. Yes.
Minister, I'm about to go to read the feedback. I know it's a lot, but before I go there, when I hear we need to, there are many who feel it is still not yet being done. It's still in the pipeline. But now I want you to talk to us a bit about what has been done to protect our healthcare workers, such that we can reduce the risks of them dropping while they're in the line of duty, trying to save our lives?
Absolutely. I would start by saying that the healthcare workers are doing an excellent job, and that the ones we lost is a huge loss to our system, but to their families, and we must do everything in our means to ensure that the protection is actually enhanced, and we bring necessary therapeutics that unfortunately are some are in trial, but this is what the government of Rwanda has been doing from day one. So unfortunately, we are talking about a number that is already infected, but we've put in place means for protection, known as infection prevention control, that were taken to the highest level. We are providing treatments in treatment centers, everything covered by the government, and also the consideration to support the families also that I may not talk about here, but is also organized. And for the healthcare providers themselves and hospitals, there's going back and see what went wrong, how this virus came into our existing protection mechanisms. And what we're learning so far is that there are some life-saving actions that some providers that must do to save someone's lives despite exposure. I give an example. The first case we confirmed was doing a resuscitation of a patient who the patient may have infected the provider who passed, and then also that is how the case were transmitted. So you imagine trying to save someone with all means, sometimes doing actions that are very, very close contacts, and the patient is also releasing some of these fluids that are very infectious, and it happens to be the starting of the spread within the intensive care unit. So you'd say, could we have done better by providing, or the provider should have avoided the patient? No, it's a mission, it's the risk we have to take to save lives, but sometimes it comes with another risk to the providers themselves. And we are looking at all those areas and see how next time we can detect much earlier, but we are also glad that we knew it before it goes too far beyond even the units where it was detected.
I'm going to go to the screen there, but Honorable Minister, you've already answered a very critical question that was asked about lockdown, and you said no, not just yet. We have had enough lessons to learn from COVID in managing this kind of scenarios. But let me ask you, what would make us go to a lockdown? What are the factors that would make us get a cabinet yellow paper saying lockdown?
That's a very good question. Every day we are tracking numbers. We're tracking the contacts. We're seeing where the problem is, and we are learning a lot every single day. And that is reassuring in a way that we don't see indications of taking extra measures or measures that will block people's activities, sometimes also causing other health problems. But to me, if it happens to be like community transmission, for example, that the worst case scenario, where you have cases everywhere and you don't know where the cases are coming from. You've lost track of contacts, and that is the phase 4 of any outbreak control. That is the last one. We are still at phase 1. We are not yet at phase 4. So by the time we get to phase 2, hope we're not, we will be able to see how we evolve. But thinking about lockdown, I think, is also the memories of the past. But let's work together. And it's not the only job of ministry or WHO or RBC and other governments partners, it's everyone's role.
Yeah.
You have the symptoms, tell us, we pick it before it spreads into your village or friends.
Yeah.
Clean your hands, wash your hands, then you kill the virus you have touched on.
Yeah.
That is how we can avoid such measures.
Right, right. Let me read some feedback, and then Dr. Brian, you can also jump in on this. I have one from Mugisha, who says, I appreciate the work done by the National Command Post to mitigate the virus. And how has the ministry positioned itself to work hand in hand with the Rwandan community? I think it's a very important question. What's happening from the community perspective? I think Dr. Brian also alluded to the importance of working with communities. Any of you can take that.
Yeah. Well, maybe I'll talk broadly, and then Minister will be specific. The community is really actually the bedrock. I think you talked about the lessons learned.
Yes.
The lessons that we learned from Ebola in West Africa, 2014 to 16, and the lessons that we learned from the COVID pandemic were very clear, and Minister talked about the challenges with misinformation, etc. So the community is really critical. And I think we are happy with the work which had already started. I think you mentioned, how are we learning, how are we improving?
Yeah.
We had already been working with ministry in supporting the development of strategies and plans for pandemic preparedness. We have worked in building the capacity of health workers so that they will be able to do a better job. We've been working on strengthening the system for identifying, but also working on communities.
Yeah.
So it's really key to ensure that communities are aware. Communities, as Minister has said, are able to report quickly. So I think I know you said, saying we need to.
Yeah.
We have done well, I think. We have communities that are well informed generally, but we still need to do more to make sure, because it's engaging with the communities, it's working with them, it's having them having ownership, it's having them realizing that, for example, passing WhatsApp that you don't know its source is actually quite damaging, because you may be passing information that's not true,
correct,
which the next person believes, and then that person doesn't follow the advice given. They then ignore it and they say, oh, no, this is not true. Yeah. So that's key.
Minister, we are highly a communal country. We work in communities. In Uganda, we have the monthly cleaning. What measures have been put in place now to work with the communities through such available channels?
Yes, communities is everything.
Yeah,
it's very important, and I think even for previous outbreaks, we've been able to succeed because of community engagement.
Yeah.
So I think that is why in Rwanda even healthcare system is built from its foundation from the community.
Wonderful. Let me quickly check. I can see there's a lot happening right here in terms of the live tweeting from several people who are actually watching right now. I think I'm going to quickly go to the notifications, because a lot of them are actually coming directly in that specific sense. We need an assistant who can sift through some of this. George says, hello again, Eugene. Is there a cure, a treatment? As far as I have researched, there is no vaccine to Marburg. What do you tell him? In terms of cure, how far are we to getting the cure?
Yes, so we did mention, Minister alluded to it, and I highlighted it. Yes, it's true, we do not have treatment, we do not have a cure, but we do have a number of candidate vaccines and candidate treatments, therapeutics.
Yeah.
Like I mentioned earlier on, we as WHO have coordinated with partners, so this is not just WHO, but this is working with different governments, partners, and we have put in place the research that we will be doing.
Yeah.
So there are some candidate vaccines, candidate therapeutics, which are promising.
Yeah.
What we now need to do is very quickly, in this outbreak, be able to test them and make sure that we see which ones work better.
Better than the other ones.
Yes.
Right. Ask them.
We are very hopeful.
Yes. Ask them, when can we predict the end of this? This is from Dukeshimana. Patient is asking, when should they predict that? And then I have Yeson who says, thanks Anangwe for the presentation. Are all hospitals able to test Marburg virus disease currently? Can one go to test before she or he gets symptoms? And what is the advice on meetings, conferences, especially international ones, being held in Rwanda?
So, good questions. Predicting when this outbreak is going to end will be, I think, too early to say, but we have indications from other previous outbreaks, and putting together all the efforts, probably in the next few months, we will be able to overcome this. It depends on how we work hand in hand. On the conferences and meetings, I think we are not saying stop what you're doing, but do what you're doing with caution, checking on the symptoms, but also taking measures to make sure the contacts, you avoid the virus in case it is somewhere getting to you by washing and sanitizing. So, I mean, there's a lot we're learning from this outbreak, but one thing is that these therapeutics, these vaccines that we're going to acquire very soon, and some antivirals already received, we are giving to our patients, are giving good results, which is another hope to those in treatment and to anyone who may get the virus. But also we have to tell the truth that this is not like other viruses. It is associated with very high mortality rate, and that's why we need to detect early. And this is not a simple test. It's a test with very high biosecurity level, the highest, level 4, which needs to be done with highly trained people. So the question was, can we have it in all hospitals?
Correct.
The answer is not yet now. But now we have 2 laboratories in Rwanda that are performing it at the highest turnaround time, and we are aiming to even expand.
So meaning now we should not expect tests at conferences or test results the way we had in COVID time, not now?
No, not now. There are some rapid tests being also tried, not yet on the market, but we are following very closely. Hopefully in the coming weeks we may get some candidates here.
There's always 2 sides of the coin, Dr. Brian. There are those who believe in what is being said, but then there are also those who believe in conspiracy theories. And I want us to address them tonight because they also have their theories. I say, these are things manufactured to just finish us. Why is it only us? I want us to strongly talk about why we have to take these precautions seriously and why it's important for us to take the advice and the directives given from a World Health Organization perspective.
Maybe before I answer that question, if you allow me, I want to pick up on the point that you made, or the question you alluded to, regarding testing, where you said, can we just test even asymptomatic people out there? Unfortunately, testing asymptomatic for this condition, it's a bit different from the other viral infections, because the problem with Marburg viral disease is that for you to have a positive test, usually that only happens when you have symptoms. Usually by the time you get fever, your test will then become positive. What that means is if you test before, it's not only are we wasting the few resources we have, but more problematic is that you'll be tested and you say, I am okay.
But yet
by the time your test becomes positive and you are now going to pass the infection, you now have this false sense of security. I have my result. I am negative. So that actually can become very dangerous. So we have to always look at the context. And for Marburg viral disease, it's not recommended to test people who are not infected or even people who have had contact and do not have symptoms.
So usually strongly relying on people's goodwill to walk into the health centers to say, I have these symptoms and I feel I'm unwell.
So if we screen only, one, the little resources we have, we will waste it. But secondly, it doesn't even help us. And third, it can become dangerous because then we have a false sense of security. I am negative. I've got my test. You remember during COVID, we walk around with our results. Unfortunately, with Marburg, yes. So I just wanted to highlight that because that's very important.
On that one. We have very few minutes to go. I always tell people this is the shortest 1 hour that we have. But I'd asked about the conspiracy theorists, especially those who probably have downplayed this. And they've said, but also coming back to the COVID-19 fatigue, and stigma attached to some of the protocols of prevention. And you've had people asking you, why are you walking with that thing? Come on, remove that mask, or stop those things of the sanitizers. Let's talk to these people tonight, Honorable Minister, as we come to a close. Yeah.
Thank you. That is very important to think that when COVID came, people were not presenting any symptom. When they were tested positive sometimes, and they would ask questions, why am I here?
Yeah.
First of all, sometimes they get it and they walk out without any complications. But now we are talking about a virus with a very high mortality rate, with a severity of symptoms that will never let you stay home. You actually go to a health facility anyways, because it's a 39 degrees Celsius fever, severe headache, muscle pain, fatigue. Definitely we go to a facility. But it's better for us to know and detect before it even gets there. And as I said before, it takes a day when the fever starts to peak for you to go into another phase of severity. And that's something dangerous about this virus.
Yeah.
And I would say it's easy to prevent if you are not in a situation of the healthcare workers I mentioned before.
Yeah.
By just making sure you don't contact or take or shake hands even unnecessarily, or even you do, just put a little bit of sanitizer regularly, make it a practice, and just watch those symptoms.
Yeah.
The two things can help us to avoid the spread and be okay, because I have trust and I have hope that in the next few weeks we will be done with this outbreak.
Yeah.
But we want to achieve that without losing so many lives, because that is the bad thing about this outbreak.
Right.
It takes lives so quickly.
Yeah. How about children? We know about COVID, there was that aspect that children were not so much affected. How safe are our children on this Marburg virus?
Marburg is very aggressive to everyone. It doesn't spare anyone. But there is also one fragile side of it. It's a very fragile virus when it gets out of the body. It's on the family of RNA virus, which is very unstable, and one single soap, wash hands, or alcohol passing on the sanitizer will kill it. However, when it gets in the body, the only defense mechanism to not die is to invade quickly, to get to multiply so quickly. And we can only overcome it by stopping it from entering someone's body.
Right. We are done.
Maybe just a final one.
Yes, and I wanted to look at this camera as you add that point and give your commitment to the nation.
The key one relates also to dealing with when people have died. Burials have to be done safely. So that's a very dangerous part of the virus that has to be done. And I think we have to educate our communities to make sure that is done. So I think sort of in final, I think it is possible, very possible to defeat this virus. But we have to work all together. I think we've talked about how the communities are the bedrock of the response. So we really need communities to listen to the guidance that's being provided, to ensure that they get the information, to ensure that they come early when they have symptoms, they report. When they have somebody who is infected, they make sure they come for services, they're actually put into isolation. So we really need to all work together, the community, of course, us as partners, working with government, the health workers. Together we can defeat this disease. We have seen it defeated in other countries, and it is possible. And Rwanda is a very strong community health system. And
Thank you, Minister. 30 seconds. Just talk to the country. Just look at that camera and talk to them. which one? Yeah, right, that one. Yes.
Thank you, Eugene, and Dr. Brian. I think we're going to win this battle. This outbreak is going to end, and this is the critical time we have to come together by everyone doing what is requested to be done. And I'm sure soon we'll be okay. And this is how we've done before, and we are going to do it also for Marburg. So let's stay together and stay strong.
Yeah. Thank you so much, all of you, for making time. Honorable Minister, Dr. Brian, thank you. I think our time here is done. For those who've been watching, the conversation continues on our social platforms. As always, my name is Eugene Anangwe. Thank you for being a part of the show. I think we can stand and leave the way we came.